So basically the aim of today's lecture discussion is this is a cone beam CT scan. Can you see? Most of you जिनका discussion नहीं हुआ, you might find it difficult to navigate this and see what all is visible here. Interpret करना मुश्किल होगा. So the aim is कि after 40 minutes you should be able to go through a basic CT scan and be able to interpret, inference your findings. Okay. So first of all, what is a CT scan? Basically, currently we have two technologies, conventional CT scan and then we have CBCT that we do it here, cone beam CT scan. Okay. So first we are going to talk about conventional CT scan. So basically, ये तो देखी होगी machine. This is a CT scan machine, right? The patient is passed through this huge ring. ये ring में donut shape ring. इसमें एक side पे we have the X-ray emitter, दूसरी side पे we have the sensor, and it is rotating at a very high speed. Okay, so this is how the patient goes in, and the area that that intersects with the area of the body that intersects with the beam, that area is recorded. Okay, now in this the recording of the data is done in slices, एकदम thin slices की तरह होता है. I'll show you. So now इसमें I'm going to show you कि कैसे रहेगा. So this plane is representing the X-ray beam and this is what is recorded. वो यहाँ पे दिखेगा. So can you see? So basically we are stacking these axial slices on one on top of each other and we are recreating a 3D view. Okay. Once we have this 3D view, we can just section it into different slices. This was initial the axial slices. Then we can cut this 3D view into sagittal and then coronal also. Okay. So let me show you the different planes. जो terminology that I'm going to use is this is the axial plane. इस पे ध्यान मत दो. This is the axial plane that divides the body into upper half and lower half. Not half, up, superior and inferior. Okay, and then we have the frontal that divides the body into anterior and posterior, and then we have the sagittal plane that divides the body into left and right. Okay, so इसमें ही slices भी conventional CT scan में we have three slices, that is axial. This is the axial, this is coronal and sagittal. Okay, so I'll show you an animation again. So basically इसमें क्या हुआ, you can see the X-ray not slices, axial slices that are being stacked on top of each other like this. Okay, and you can even see the lines of the slices. Okay, so once we have the 3D view, we can cut this 3D view into any other view, the view that we want to generate. So initially this was let me go back. Okay, so this is the sagittal view that is generated from the axial view. Okay, then we have the coronal view. Okay, now if we want कोई अलग ही view बनाना है, we can do that also, which is a combination of sagittal and coronal in this case. We can also generate an OPG view also if we want. Okay, I'll show you the technique. Okay, so this was basic CT scan. Okay, so I'm going to show you a CT scan because time ज़्यादा नहीं है, तो I'm going to move fast. And I am recording this in case अगर आपको बाद में कभी देखना, आप देख सकते हो. Okay, so here you can see I have loaded a CT scan of a patient. This is the axial view. This is going up and down, right? This is the coronal, anterior posterior, and this is the sagittal, left to right. Okay, now to make things easier for you, I'm going to go and enable the 3D view and let's connect this. Okay, so first let me show you axial view. Can you see this? ये जो view दिख रहा है, ये जो view दिख रहा है, it is here. ये जो black plane दिख रहा है, so if I move this, it represents किस level पे ये slice है. Okay, so if I move it upwards, so exactly at this level, can you see this plane is intersecting with the zygomatic bone and the nasal bone and the nasal cavity. Can you see this is the zygomatic bone, nasal cavity and maxillary sinus. यही level पे we have the maxillary sinuses, right? So in any CT scan, if you want to understand the CT scan, you need to first know the anatomy of that region. अगर आपको anatomy ही नहीं पता होगी, you won't be able to decide कौन सा area देख रहे हो आप, right? Another thing, there are times that you get lost in the CT scan कि आपको नहीं पता ये क्या दिख रहा है. Then what you can do is you can move a few slices up or down, go to the structure जो आप identify कर सकते हो. In this case, I can say, okay, this is the maxillary sinus, and from here, if I'm moving up, maxillary sinuses के ऊपर ही we have the let me just maximize this. Slightly above the maxillary sinuses, we have the orbit, which is visible here, orbit. And if you want, you can see some. I don't know वहाँ पे दिख रहा है कि नहीं. यहाँ पे ग्लोब का भी थोड़ा सा इंप्रेशन दिख रहा है. ओके, सो लेट मी जस्ट मूव आउट ऑफ दिस. ओके, अनदर थिंग, यहाँ पे 3D में सिर्फ बोन दिख रही है, बट वी कैन डिसाइड हमें क्या देखना है. वी कैन, everything is recorded in the CT scan, but then we decide कौन से threshold, which density is the cutoff point. Okay, if we decide कि density, this much density के बाद soft, lower density वाले structures नहीं दिखेंगे, इससे higher density वाले structures दिखेंगे. If I further increase the threshold of the density, the enamel is the densest structure in the body, densest tissue in the body. So what we are seeing is enamel दिख रहा है, बाकी bones भी नहीं दिख रहे. Okay, so it is up to me. Again, you are not expected to operate this software at your level. आपको बस अगर कोई film दिखा देता है, X-ray, CT scan film, you should be able to, you should be confident enough to go through the slices. Okay. So again, the same thing. Can you see at this level? You can see we have the orbit and the nasal cavity. So let's move down. I'm going to cover it very fast. So this is the axial view. We are moving down. So can you see? Again, we have the zygomatic bone. If you see at this level, this zygomatic bone, and इसके पीछे क्या जा रहा है? This, we have the zygomatic arch, right? So you can see the zygomatic arch like this. Now another thing, this view that you're seeing, आपके हिसाब से हो सकता है this is the right and this is the left, which is wrong. So this view is generated. It's like you're standing at the feet of the patient and looking at the patient from down. Okay, ऐसे. So now if you see patient का ये left side and this is the right side, right? So that is why again this is the left side of the patient and this is the right side of the patient. So if you find any abnormality on this side, you're going to say that abnormality is detected on the left side of the patient. Okay, ये ध्यान रखना है. So we have the zygomatic bone and zygomatic arch, and medial to the zygomatic bone we have the maxillary sinus. Medial to the maxillary sinus we have the nasal cavity. Okay, so if we further move down, क्या होगा? maxillary sinus के नीचे क्या है? You can see maxillary sinus getting smaller and smaller. Okay, it is the largest at the level of the zygomatic bone at the apex, and as we move further down, it is going to reduce in size. One, second, जैसे जैसे नीचे जाएंगे, you can see you start seeing the arch. पहले you're going to see the palate, and then as you go further down, you'll start seeing the arch of the maxilla. Let me zoom in. Can you see arch of the maxilla? And in that, you can see the root apices. These are the root apices. And second, what is this? Anterior maxilla में palatal side पे what is this structure? Incisive foramen ये है. But if it is totally surrounded by the bone, that is a canal. Nasopalatine canal रहेगा ये, right? So this canal is better visible in sagittal view. Let me show you. Can you see this? This is the sagittal view. Can you see this? यहाँ पे this is the foramen, but this is the nasopalatine canal, right? Let's go back. Okay. So now maxilla के level पे, can you see we start seeing the ramus also. So again I'm going to move further up. फिर से ऊपर से नीचे आएंगे at the level of zygomatic bone. Okay. Now if we go further down at this point, can you see you start seeing the slices intersecting with the coronoid and the condyle, right? So at this point we have the maxillary sinuses in the slices, but you also see these two islands of bone. These are coronoid process and condyle head. Okay, and beach mein there is a gap because we have the sigmoid notch here. Okay. Again, as we go further down, let me see if I can change this. ना अभी उतना टाइम नहीं है खेलने का. Anyways, so if I go further down again, so we have the coronal process, condylar head, right? If we go further down, sigmoid notch खत्म हो जाएगा. You start seeing the ramus. Now this is the ramus on both the sides, right? Now just keep an eye on the medial surface of both the ramuses. You'll start seeing a foramen type structure. What is this? Mandibular foramen, that is on the medial surface of the ramus, right? And as we go further down, let's move in. Again, move up. We have the mandibular foramen. If we move further down, you'll start seeing this foramen. It is going inside the bone. If you remember the inferior alveolar nerve, it enters the mandible through the mandibular foramen and goes into the mandibular canal, that is inside the bone, right? So if we go further down, can you see this circular structure? This is the canal now, okay? On the other side also, this is the canal now, okay? Okay, now the important thing to note here is, यहाँ पे canal देख लिया आपने. We are going further down now. From the level of ramus, जैसे जैसे नीचे जाएंगे, you'll start seeing the teeth. If we go further down, you'll start seeing the bone, mandible. Okay. Now, what is the abnormality that you can see here? We have the fracture. Which side? Right side. This is the left side of the patient. This is the right side of the patient. So right parasymphysis fracture here. Okay. This is the midline, central, lateral, and this is the canine. So lateral and canine के बीच में है, तो it is parasymphysis fracture. So we have the right parasymphysis fracture, and you can see there is a displacement of the fracture segment, right? So in this is the only thing that is of importance to you guys. समझ आया? If you know the anatomy of the area, it is easier for you to navigate. I will keep the watch here, so मुझे याद रहे. Come on. हाँ. So this was the axial section. Now we are going to go to the coronal section. Let me just remove this. Okay. So now coronal section is this one, which divides the body into anterior and posterior. Okay. So this is this section, and if I move it, you can see it is moving anterior posterior, right? So what I'm going to do is एकदम anteriorly मैं आ जा रहा हूँ, and then I'm going to move back. Okay. So what is the first structure that is intersecting with the plane? Nasal bone, right? So you're seeing the nasal bone. As we move further back, you can see the anterior maxillary incisors. And what is this? This is the forehead. That is the frontal sinuses. यहाँ पे, ठीक है? Can you see? These are the frontal sinuses and upper and lower teeth. This is the nasal cavity, and if we move further back, again, let me see. Can you see this maxilla में, anterior maxilla में? Can you see? इस level पे है ये. Again, the same thing, incisor foramen and the nasopalatine canal. This goes into the nasal cavity, okay? And these are the upper and lower teeth. If I go further back, can you see? यहाँ पे fracture दिख रहा है. But again, mandible में fracture देखना है. The most commonly used one is the axial slice because it shows the whole arch. Can you see? Okay. इसमें इतना clearly नहीं है because you already knew there's a fracture. You were able to locate it easily. Okay. So सारे ही slices एक साथ एक एक करके देखना, and then you can correlate कि किसमें क्या defect है and कहाँ पे है. Okay. Now, as we move further back, you can see there's a fracture, and now of course it is cutting the body into this plane. So you're going to see only two teeth at a time. These are the maxillary molars here, and on above the superior to the maxillary molars we have the maxillary sinuses, and maxillary sinuses के ऊपर we have orbit. Okay. And what is this? Premolar and molar region में. If I show you mental foramen, दिख रहा है ये यहाँ पे? If I remove this, can you see this? We have the foramen. So let's go back. So when the plane intersects with the foramen in the 3D view, you can see the foramen here also, right? So इसमें you'll be able to locate the canal much better. Now mental foramen दिख रहा है यहाँ पे? Just follow the mental foramen. Can you see? यहाँ पे we have the canal. As we move further back, you still see the canal here, As we move further back, you can still see the canal. If you go back, still see the canal, and it exits through this. Okay, so we have the fracture line. Now, one thing you missed in the axial view was आपने right parasymphysis तो बता दिया, but you forgot to see this. Let me go back. Yeah. Let me zoom in. Do you see the breach in the continuity of the bone? So ये कौन सा है? Left angle and right parasymphysis fracture है, which is visible here. दिख रहा है? Right, left angle and right parasymphysis fracture. Okay. So which is visible here also? Can you see this left angle region? Okay. So many times if you don't have the 3D view, you'll have to go through all the slices to decide कि हमने सारे ही areas अच्छे से scan कर लिए हैं. Okay. By mistake, you guys didn't catch this fracture, which is visible better here. Okay. आप दोनों side compare भी कर सकते हो to see if this is the normal side. Is this normal? यहाँ पे you can clearly see the continuity of the bone, whereas this there is a breach in the continuity of the bone. Okay. So again the same thing. Can you see? यहाँ पे fracture line दिख रहा है. This is much better for visualization of the angle fracture. Okay. Now again the same thing. Let's go back. So we have the slices in the mandible body region. So as we move further back, you're going to start seeing the ramus. Okay. So can you see this? This is the coronoid. This is the ramus and the coronoid process. As we move back, इसकी height कम होगी. Why? Because we have the sigmoid notch, है ना? It goes down. See? So we have the sigmoid notch here, and as we move further back, again the height increases and we have the condylar heads, and condylar head is inside the glenoid fossa, right? And what do we see? What are these black? Mastoid hair cells, yes. Okay. So this was the coronal section. समझ आया axial coronal? Now I'm going to go through the sagittal sections. So again, sagittal section divides the body into left and right. Okay. So currently it is exactly at the center. So center mein we have the anterior, that is the symphysis region. Can you see? Central incisor and the symphysis. Here also central incisor, and we have the palate. ये जो आपने lateral ceph में देखा होगा वैसा image आ रहा है of the palate and the anterior maxilla. Again we have the incisive foramen and the nasopalatine canal. This is the palate. Okay, this is the nasal bone. So what I'm going to do is I'm going to move to one side. You guys keep an eye on this. Let me go back. Now you guys keep an eye on both the thing. दोनों आप correlate करो. ये कौन से region में slice है and यहाँ पे क्या दिख रहा है. Okay. So I move it to the other side, left side. Now another thing, you might say if it is exactly at the center, we should be able to see the nasal septum, which is exactly at the center in the nasal cavity, but वो नहीं दिखता है. Usually like me, मेरी nose slightly deviated है to the right side. Patients की भी nose is not exactly at the center. Okay, या फिर patient का CT scan लेते time पे the head is not exactly straight. Okay, so there's a possibility that you might not see the septum completely in one slice. Can you see? यहाँ पे bone दिख रहा है आपको. When you move left and right, you will be able to see septum in some different separate slices. थोड़ा थोड़ा करके. Okay. Okay. So slightly we are moving to the left side. So as we move further to the left side, this is currently we are inside the nasal cavity. Okay. Again the anterior maxilla and the palate, and this is the symphysis region or parasymphysis region. Okay. Now as we move further on the left side, you start seeing what is this? Maxillary sinus. Okay, left maxillary sinus. And let me zoom out. This is the orbit. Okay. So as we move further to the left side, again we're going to see the molars and the molars in the upper and lower maxilla and mandible. As we move further to the left side, again what do you see? This slice is intersecting with the fracture line here. Can you see यहाँ पे? Let me zoom in. Can you see this? we can clearly see the breach in continuity of the bone, and that is the fracture line of the left angle. Okay, again the same thing, as we move laterally, you start seeing the coronoid and condyle. Again, because this plane is exactly straight but this coronoid, the ramus is slightly angulated, तो दोनों चीजें एक साथ देखना is going to be slightly difficult. Okay, but we can change the plane. There are for softwares available in which we can decide the custom planes. यहाँ पे सिर्फ 3 planes दिए हैं, but we can decide कि हमें कुछ अलग ही plane में slices बनाने हैं. I'm going to show you that in CBCT section. So this was your sagittal section. So if you know the anatomy of the region, you can easily navigate the area. Okay, so I'm not going to go into the details, it's already 9 o'clock. So these were the 3 basic slices, that is the axial, coronal and sagittal slices. Okay, and we can of course generate a 3D view from the axial slices, and we can decide हमें क्या देखना है. Do we want to watch the soft tissue or we want to see only the bone? Okay, इतना समझ आया conventional CT scan. Now we are going to move on to the CBCT because again time नहीं है. So now difference between conventional CT scan and CBCT is in this you saw that the patient, let me open the image. In a conventional CT scan, slices are recorded, thin slices are recorded, and then they are used to create a 3D view, a volume of the patient's skull. Okay, and then usme se we can generate different views. Okay, whereas in cone beam CT, CBCT, what happens is we record a volume, then we generate the slices from it. Okay, let me show you. I hope you remember this animation. Slices are being recorded, and from that we generate the 3D view, and then from that we generate the other coronal or sagittal views. But in CBCT we record a whole volume. Okay, एक साथ 3D में ही record करता है. It records a large volume in one go. Okay, like this. Can you see now? The shape of the beam in this animation is slightly off. Ideally, the shape of the beam should be conical, as the name suggests. In conventional CT scan, it is a thin slice, whereas in cone beam CT, you can see it is a cone shaped. Okay, so don't mind the animation shown here. The shape of the cone is slightly off, but you get the idea कि एक साथ इतना सारा volume record कर रहे हैं. So if we record 5 to 6 volumes like these, and then we overlap them on top of each other, you can easily generate a 3D view. Okay, and then from that we can generate different views, sagittal, coronal, axial, right? So as we are अभी जो CT scan मैंने दिखाया था ना, in that we had around 350 slices. So patient was irradiated these many times for every slice, right? Whereas in this 5 or 6 volumes ही record करने होते हैं. So the exposure to the patient is almost 30 times less in CBCT as compared to conventional CT. One, in conventional CT, the quality of image recorded nowadays is way higher as compared to cone beam CT. Okay, and of course the time required to record in cone beam CT is very less, whereas in CT scan it is way longer as compared to cone beam CT. Okay, so do you understand the difference between first? Conventional CT scan, we have the fan shaped beam in which we record only slices, whereas in cone beam CT we have a cone shaped beam where we record a volume at a single go. Okay, so now we are going to move to software that is specialized in CBCT viewing. Now another thing I want to not this, yeah, do you see this these images? .jpg लिखा है सबके पीछे. What are these format? .jpg, images or pictures, right? ऐसे images के format होते हैं BMP, JPG, PNG, GIF. These are all image formats जो आप अपने कोई भी phone में open कर सकते हो या कोई image viewer में open कर सकते हो, right? So इस एक image को, JPG image को open करने के लिए we have अलग different softwares to open this single image. Okay, similar way medical images के लिए we have something called as DICOM format, DCM images. Okay, these are different than these images. They have way more data of the patient. Okay, this is just for your information. There's something called as DICOM files that is used for medical images. Okay, and ये DICOM files open करने के लिए भी we have many softwares. Okay, अभी जो मैंने सॉफ्टवेयर ओपन किया था that was called Slicer 3D, जिसमें मैंने आपको 3 slices दिखाए थे, axial, sagittal, coronal. Now I'm opening another software that is don't tell me. Okay. Axial sagittal coronal slices जो मैंने दिखाए थे, that was slicer 3D. Now this is a software that is meant for especially CBCTs. Okay. Now this is a CBCT of a patient, my own patient. If you see the 3D, let me expand this. If you see the 3D, यहाँ पे आपको clearly दिख रहा है there is some pathology here, bone resorption है. If I rotate this and go to the palatal side, okay, you can see okay, this is way larger than what you thought. सामने से इतना बड़ा नहीं दिख रहा है, but if you go to the palatal side, okay, we have something here, right? Now in this, remember this is the central incisor, lateral, this is the canine, this is the first premolar. Now if I zoom in, you can see the central incisor root apex is slightly involved, but the apex completely is not involved. Thoda sa portion is involved and rest of the root is inside the bone. Whereas lateral, the apex is almost at the center of the pathology. Canine ki root, can you see? It is covered by the bone. Palatal portion is somewhat involved in the pathology. If you see the premolar, you can see usually premolars have two roots. Okay, in this the palatal aspect of the root is inside the pathology. Okay, again in this software also, if I want, I can decide what I want to see. I can set the threshold. I can set the threshold and visualize what I want to see. Okay, now what is this view? This is the axial view, right? So what this software does is, मैंने अभी आपको बताया था, in the conventional CT scan we have only three views, right? Axial, sagittal, coronal. Now what we can do here is, I want to see a panoramic view. Now this software give me the option कि मैं different plane decide करूँ in which I want the slices. Okay, so can you see this gray line? Let me zoom out. So I'll make this yellow line. So let me show you this first. So can you see this? I can decide मुझे कौन से plane में slices चाहिए. I'll just mark the curve along which I am going to see the slices. Okay, let me make this. Okay, so now keep an eye on this and this. If I move any of the point here, can you see? So what's happening here is, I am telling the computer, the software, that I have drawn the arc on this line. So इस arc के ऊपर जो भी area है, just take that and flatten it. Okay, curve था ऐसे, you just take this yellow line, whatever is visible on that yellow line, and then flatten it and show it as a panoramic view. Now this is not a true panorama because this is a very thin slice, around 0.5 mm की slice है ये. So if I want to visualize, make it like a normal OPG, so I can just decide that not only that thin line, whatever area is visible in this yellow box, take that, flatten it and overlap each other. Now you can see this is somewhat looking like a conventional OPG. Okay, now the problem is conventional OPG exactly नहीं बनेगा because this is the area recorded. Now in CT scan, conventional CT scan पूरा head record होता है, whereas in CBCT you can decide a smaller area that can be recorded. पूरा head record करने की जरूरत नहीं है. Okay, that also reduces the exposure to the patient. So यहाँ पे जितना भी area था, especially the maxilla, I've told the software to take that area, flatten it and show it as an OPG view. Now इसमें भी दोनों views में, can you see we have three lines, blue, yellow and red, and on this also we have blue, yellow and red line. दिख रहा है वहाँ पे screen पे? So can you see this here? We have the blue box, we have the yellow box and we have the red box. Okay, so ये तीनों boxes क्या दिखा रहे हैं? ये जो blue line पे क्या view है वो दिखा रहे हैं. So basically now the cross sections are going along the arc. Okay, first OPG view बन गया. Second, if I move this, can you see the arc? The view is moving along the arc. These three lines are moving along the arc. So we have told the software that we want the slices along our custom path, not axial, sagittal, coronal. We have decided our own path, right? So the views are being shown along the path. So what I'm going to do is, I'm going to start from the right side. Again, as I told you, this is the left side of the patient, this is the right side of the patient. Okay, so I'm going to start from the right side and move anteriorly. So you can see there's nothing too special. Let's go back. This is in the maxilla we have the third molar. nothing too abnormal that is seen here. Then we go into the second molar region, we can see the roots here, and if we go further we can see the first molar, again nothing too abnormal. Again, because of the angulation, you might see the palatal root, mesial root, palatal root and distobuccal root, and then the mesobuccal root of the same tooth. Okay, सारी चीजें एक स्लाइड्स में दिखना जरूरी नहीं है. Okay, now as we move further ahead, now another point you remember this, ये व्यू जो दिख रहा है, if I move further, ये व्यू यहाँ शिफ्ट हो गया. So you don't have to look at all the three views, just center वाला व्यू पे नजर रखो and keep in mind that this is the yellow line. That is more than enough. Okay, so again, if I move along the curve, I don't see any abnormality currently, right? Okay, now what is this? Again, incisive foramen and nasopalatine canal. Okay, now if we move further towards the left side, okay, you start seeing something here, right? So let me just expand this so that you see the pathology. Okay, can you see? Let's go back. As we start seeing the nasopalatine canal, you also start seeing there is some erosion, there is resorption of the bone on the palatal side. Can you see this? So what I'm going to do is, I'm going to expand this now. Okay, again, nasopalatine canal, that is at the midline, and you start seeing the bone resorption, and also you see the bulging of the soft tissue here. Go to the opposite side. Okay, now you see the resorption is increasing in size and it is almost breaching the nasal floor. Can you see there is very thin line at the nasal floor, right? So this is the left side, not left, right side central incisor. Now we are, okay, this is the right left side central incisor. Let me go here. I went to this. Okay. Okay, so we are at the left side of left side central incisor at this level. Can you see there is a very thin line separating the central incisor apex from the lesion? Okay, so कई बार होता है 3D view में you might not see that very thin bone. वो इतनी thin होती है कि वो 3D view में नहीं दिखेगी. Okay, now as we move further towards the other side, you can see we have the lateral incisor that is completely inside, the apex is completely inside the center of the bone, center of the lesion, and you can see there is some bone resorption here. There is some, let me zoom in, there is some bone, but it is so thin that it is shown in the 3D view as resorption. Okay, यहाँ पे दिख रहा है, can you see the white line, faint white line? There is some bone, but it is so thin, because it is so thin that the density is so less that it is visible as a bone resorption in this 3D view. Okay, now let me zoom out. Okay, now if we move further towards the other side, now we start see the canine. Can you see this canine? So canine also, palatal aspect is inside the lesion, whereas buccal aspect of the root is inside the, it is covered by the healthy bone. Okay, now if we move further back, can you see we have two roots of the premolar. We are at the premolar now. So palatal root apex is inside the lesion, whereas buccal root is in the normal bone. Okay, जो हमने अभी देखा था. Okay, so this is your custom slices that you can decide in the CBCT software, and this is what you get in these. ये जो आपको अगर CBCT आप करवाओगे बाहर प्राइवेट में कोई रेडियोलॉजी सेंटर से, this is what you get for CBCT. You get the custom slices. Okay, that is one. One thing I want to show you guys is, let me just move here. ये दिख रहा है, ये भी एक व्यू है which is green colored box, and यहाँ पे green color की line है. So this is used to visualize 360 view of a tooth. नहीं, जो भी area आपको देखना है. Let me just move to this and let's focus to the lateral incisor. Now what I can do is, if I rotate this and keep it parallel to the yellow line, the view is same as that the yellow line, right? But let me zoom out. What I can do is I can rotate it and visualize 360-degree view of that area, that point. Okay, ये जो center में जो area रहेगा उसके around we can rotate and see what the 360-degree view is. Now this is especially helpful in implants. After placing the implant, you want to see whether there is sufficient bone around the implant. What you can do is you can focus this over an implant and then just rotate it and see the 360-degree view in this. Okay, so it's already 9:14. So this was the basics of CBCT. Now अभी जो मैंने आपको ये प्रिंट दिखाया था, वी गोइंग टू टॉक अबाउट दिस इन द नेक्स्ट 10 मिनट्स. ओके, so if you advise for a CBCT for a patient, what you're going to receive is this, something like this. ऐसे print मिलेगा आपको. Okay, so if you see, we have what view is this? This is the axial view. Okay, and यहाँ पे lines दी हुई हैं, right? Okay, so let me zoom in. This line is 45, तो इसके पीछे दो lines हैं, that is 43. Okay, and this is 70, and इसके आगे दो lines है तो 72. So basically it is showing, it is denoting we have slices in these regions. ये जो lines draw है वहाँ पे slices ली गई हैं and that are printed here. So can you see 43 to 72? Okay, so again उसका एक OPG panoramic view भी बनाते हैं and the same thing is visible here. यहाँ पे 43 to 72. Okay, anyways, so 43 से देखना शुरू करेंगे. If you see the panoramic view, first of all you'll see, okay, there's a radiolucency here. What all things can you see? We have an impacted canine. ठीक है, we have an impacted second premolar. This is the erupted first premolar. We have a deciduous tooth with root resorption here. Now we have a dark area here, so we know there's a bone resorption here. Okay, but can you see this is the normal bone and this is the bone over the first molar. This is slightly darker than this but less darker than this, right? So what you can see, there's partial bone loss in this region. I'll show you कैसे बोल रहे हैं. Okay, so these are the positive findings that you can see in relation to the pathology. Okay, so from the slice 43, that is somewhere here, distal root, you see there is some bone resorption. Now ऐसा slice cut हो रहा है, it is along the arch. Okay, can you see this is along the arch? This green line is the custom arch drawn and along that we are getting the slices. So 43 number slice, we have some bone resorption. As we move further anteriorly, you'll start seeing there is more and more bone resorption. And can you see this thin white line दिख रहा है? This is the expansion of the buccal cortex along with resorption of the buccal cortex. Okay, now at the slice number 46, this is 46 number. So can you see this? It is at the mesial root. And again another thing, can you see यहाँ पे 4-6 लिखा हुआ है? The radiologist is going to denote which tooth is visible here. Okay, so currently we are visualizing the 4-6, that is the first molar of the fourth quadrant. Okay, so in relation to the mesial root of the first molar, can you see buccally there is no bone? Can you see on the mesial root buccally there is no bone? And as we move further anteriorly, bone resorption increases. That is one. Now, can you see 4-5 here now? So the radiologist is telling you that we have the impacted, that is the 4-5 here, that is visible here. Now this is the apex of 4-5, second premolar. Now this apex is this tooth, the root of the tooth is placed in such a way that there is perforation of the lingual cortex. This is the lingual cortex, this is the buccal cortex. Okay, so can you see because of the apex of the second molar, there is perforation of the lingual cortex. Okay, and most probably because of the pathology, this tooth is pushed down in such a way that it is perforating the lingual cortex. Okay, then at the same level you can see the deciduous molar. There is complete bone resorption and it is restored पहले हुआ होगा and then bone resorption बाद में हुआ है, which is visible here. And another thing, let me zoom in every slice can you see this red dot? And if you let me zoom in further, surrounding the red dot we have a circle. This is the mandibular canal and this red dot denotes inferior alveolar nerve. Okay, so if you follow this red dot, ये क्यों select हो गया? As we move further anteriorly, you have the mandibular canal, and then finally the nerve, the inferior alveolar nerve, it exits the mandible through the mental foramen. Can you see this? Now here can you see the lesion is also involving the mental foramen. यहाँ पे bone होनी चाहिए थी जो कि resolve हो गई है, right? So you can say that the lesion is involving the mental foramen and the mental nerve. Okay. As we move further anteriorly, you see this erupted first premolar, again that is also involved, and as you move further anteriorly you see, okay, this is the impacted canine or unerupted canine, and surrounding that we have some radiolucency on the canine. Okay, this. So let's go to the other view. This was along the arch. Okay, custom slices थे ये वाले. So now what view is this? ऐसा cut हुआ है. So this is the coronal slice है ये, and इस पे lines draw की हैं. So that means we have the axial slices now. Can you see? These are the slices that are denoted, that is given here. Okay. So 15 number slice है यहाँ पे, and उसके ऊपर we have the 11, 12, 13, 14. So 11 to 35 number slices हैं. 11 to 35 slice. Okay. So now we are going from top to bottom now. 11 से start करें, 35 पे जा रहे हैं. So we are going to go down. If we start from 11 number, we can see, okay, there's a decidus molar. If you go further down, you start seeing the expansion of the bone. Now you also start seeing the impacted premolar that is pushed inferiorly and lingually. Okay, and at this level, 20 number slice, can you see? This is the first molar. Okay, we are going down. So this is the first molar. Distal root pe we have sufficient bone, but mesial root pe you can see the resorption of the bone, right? Okay, so again the same thing. Can you see? We have the impacted premolar, and this is the molar roots. Mesial root we have the resorption. Distal root we have complete bone coverage. Okay, if we move further down, important area पे आते हैं हम. Let me go back. Okay, yeah, 11, slice number 13 में if we see at this level, can you see we have the premolar, first premolar. Let me go to the 13 number slice and show you. This is the 13 number slice of 14. So we have the erupted first premolar, and उसके पीछे we have the lesion. Posterior to that we have the lesion, and can you see we have the bone and the first premolar, and the canine is completely separate from the lesion. So this is not a pathology. The radiolucency around the canine is not a pathology. It is a dental follicle. Okay. So let's move further down. Now this is again the axial slice. इसमें क्या slices दिए हुए हैं? Which is going lateral to medial, left to right. Sagittal slices. Okay. Now sagittal slice is going to give you the dimension of this lesion anterior posteriorly. Okay. So हमने almost सारे inferences तो निकाल लिए. Further again slices number again this is 15 number ना, तो 11 to 25 slices रहेंगे. So 25 and 11. Now I'm directly going to start from 15 number. So can you see this? We have the molar. Okay, 14 पे आ जाओ. We have the molar, permanent molar, mesial root bone resorption is there. We have the impacted second premolar. We have the decidus molar, and we have the erupted premolar, right? And you can see the nerve here. Can you see the nerve? And the radiologist, it is going to show you the dimensions. Can you see यहाँ पे anterior posteriorly the dimension of this lesion is 18.9 mm, and superior inferiorly we have the dimension of this lesion as 17.9 mm. जहाँ पे भी सबसे ज़्यादा dimension होगा वहाँ पे the radiologist is usually going to mark it and show it to you that this is the dimension. Okay, हाँ. So that is that. Again the same thing, the impacted premolar, the decidus molar, and impacted the erupted molar, and we have the canine that is separated from the lesion by bone and the first premolar. Okay, so we made some inferences here. Again the same, another thing, can you see this root apex of the second impacted second premolar that is perforating the lingual cortex? This is the lingual surface of the mandible. Okay, and this is a lesion in the 3D view. Can you see the same thing जो हमने अभी देखा था? Mesial root पे molar, permanent molar के mesial root पे there is bone resorption. Distal root is inside the bone. We have the impacted premolar, we have the erupted premolar, and we have the decidus tooth, decidus molar. Now, along with this print, you're going to receive a report from the radiologist. Okay, and this is one of my patient. So we're going to directly go to the report because again time नहीं है. So what does it say? Oh, so it is a well-defined, partially corticated expansile radiolucent lesion. So as we discussed earlier, I told you that it is causing the expansion of the buccal cortex. So it is an expansile lesion, and it is well-defined. You can clearly see, okay, this is the extent of the lesion. So it is well-defined and partially corticated because some portion there is cortical bone resorption. Okay, so well defined partially corticated expansile radiolucent lesion seen extending from the distal aspect of the erupting 4-4 to the, now what my interpretation here is, distal aspect of the erupting first premolar to the distal root of the first molar. Okay, now here this is where we disagree, is extending from the distal aspect of the erupting 4-4, that is the first premolar, to the mesiobuccal root of the 4-6. Now why do I say this? Because mesial root is involved in the lesion, there is bone resorption at the mesial root. Okay, बट अगेन हम दोनों का मतलब सेम है, कहां तक एक्सटेंट है, बस स्लाइट टर्मिनोलॉजीज अलग बोल रहे हैं हम, राइट. बट अगेन दिस इज व्हाट आई यूजुअली डू, आई गो थ्रू ऑल द स्लाइसेस फर्स्ट एंड देन आई रीड द इन्फ्रेंस ऑफ द रिपोर्ट ऑफ द रेडियोलॉजिस्ट, सो दैट मेरे खुद के फाइंडिंग्स तो होंगे, एंड इफ आई मिस समथिंग आई विल रीड इट इन द रिपोर्ट्स. ओके, this is what you are supposed to do. Now internal structure of the lesion is homogeneously radiolucent, you don't see any areas with spots of radioopacity and radiolucency. This is homogeneously radiolucent. Margins of the lesion are smooth. The lesion is in very close proximity to the inferior alveolar nerve canal, that is the mandibular canal जो हमने अभी देखा था, and the lesion has involved the mental foramen which we already inferred. Now there is considerable ballooning or expansion of the buccal cortex with occasional breach, again we've seen that. The lesion has caused the displacement of the unerupted 4-5, that is the premolar, and 4-5, that is premolar, is displaced in such a way that its undeveloped root has caused breach in the palatal. Now he has mentioned palatal, it is lingual cortex. So the root of the undeveloped root of 4-5 has caused the breach of the lingual cortex while the crown is facing buccally. Let's move here. Can you see the apex is causing breach of the lingual cortex, whereas it is slightly tilted, so the crown is facing buccally. Okay, and the dimension जो हमने पहले देखा था, okay, the roots of 8-5, that is the primary molar, are resorbed, and the dimension of the lesion is superior inferiorly 17.9. let me go to that sagittal slice again. Superior inferiorly, that is superior inferiorly it is 17.9 mm, and anterior posteriorly it is 18.9. so superior inferiorly it 17.9, and mesodistally, that is anterior posteriorly, that is 18.9 mm. now यहाँ पे हमें क्या diagnosis लग रहा है? what do you think the diagnosis is? here we have two things of importance. one is we have a tooth whose root has resolved, of course उसमें caries था, and we also have an impacted tooth. what is the differential diagnosis? One is radicular cyst because of the presence of this carious tooth, and dentigerous cyst because of the presence of the impacted tooth. Okay, so we have the differential diagnosis of, that is periapical cyst, also called as radicular cyst, and dentigerous cyst. Okay, so the time is up. I hope आप लोगों को थोड़ा बहुत समझ आया होगा. Yeah, if you want to take this further, you've already seen me doing things with CT scan. You can take a CT scan and then visualize the pathology like this also. वो आप लोगों के ऊपर है फिर कैसे करना है, but the basics is this कि आपको interpret करना आना चाहिए. This is from the CT scan of an actual patient. So I separated the bone, teeth, pathology and the nerve, and then उनको अलग से color करके combine किया.